So I'm going to be responding to your discussion. You talked about the overweight and obesity and physical inactivity and predominantly focus on adults. And we know that this can affect their motor function, postural control, their muscular strength and endurance, along with other things. And it is associated with, as you said, many diseases, morbidity. So I also realized that within this section of the book, it talks about children and what they can face if they are obese and overweight. So I wanted to look into that. So I found this article or study, which is the effects of overweight and obesity on motor and mental development in infants and toddlers by R. Kaltog. And this was done in, I say R because that's what his name is abbreviated to. And this was done in 2015. And I found the results to be really interesting. At a certain point prior to the pandemic, I was volunteering at a clinic for occupational therapy where it was occupational therapy, speech therapy, and physical therapy. I predominantly focus on occupational therapy, and they did focus a lot on underdeveloped children. However, this article specifically talks about the correlation between developmental delay and delay in motor abilities associated with obesity. So they have children who would be deemed normal using the BMI, so they are less than 30 of the 80 percentile, and then above, I believe the 95 percentile, so they would be classified as obese. And what they do is they have these children undergo two waves. So in the first wave, they average at 10.5 months, and there was 10,700 participants within the first wave. And they go off the Bayley scale of developmental assessment, which is used to measure their mental development, and then they go to the motor scale for fine and motor skill development. And they found that in the beginning, the overweight and obese children were behind when compared to normal children. So for motor, they scored 7.5 versus 6.2%. And then for mental, it was 8.6 versus 6.7%. And within the second wave, they now are 24.4 months on average. However, only 9,800 of these individuals returned for the study. And of course, they realized that again, their mental delay is significantly behind by approximately 3% when compared to the normal. And for motor delay, they are significantly by 5% of the normal weight children at this time, or infants. And so the overall conclusion is that overweight children are more likely the normal weight children or peers to suffer with their motor and mental development. They have delays, so preventing obesity during infancy is very important when trying to reduce a child's developmental delays. And I feel like this is very much seen in clinics where individuals are receiving a variety of therapies. A lot of them go in for developmental delay, whether it is motor or mental, and if it can be prevented by just, watching weight and food consumption, we should do that.